So if you see the anatomical positions of the appendix, so these are the location of the appendix is going to be, if you see here, so this is going to be is at the starting at the ascending colon. So this is a large intestine. So at the ascending colon, so where the is an attachment to the small intestine and large intestine. So is going to be the small projection like a finger-like projection at the ascending colon. So it's a location of the appendix. So these things are going to be, so is going to be alter the positions. So this depends upon the person to person is going to be vary. So this vermiform appendix is present only in mammals. So the position of the appendix is variable. So it's going to be different positions are going to be seen in the different type of the like a persons. So in case of the retrocecal, so the retrocecal is going to be, if you see here, so this is the retrocecal positions. So it's going to be the above the towards the ascending colon. So it's going to be the some other type of the post-ileal, also pre-ileal and pelvic regions and subcecal. So these are the different types of the appendicitis. So it depends upon the position of the these finger-like projections in the intestines. So highest percentage is when many people are going to get the retrocecal. So this is the position of the, so is towards the ascending colon. So the pelvic region is going to be the 21%, and also post-ileal is going to be the 5%, paracecal will be the 2%, subcecal is the 1.5%, pre-ileal will be the 1%. So these are the different types of the the positions of the appendix. So the position of the base of the appendix is constant, but being found at the confluence of the three tenuous coli of the cecum, which fuse to form outer longitudinal muscles coat of the appendix. So, but the base, the everything is, if these are different positions are there, but if you see the base is going to be fixed at one place. So that is the anatomical positions of the appendix. Coming to the another anatomical structures regarding the Miso Appendix, and also, so this Miso Appendix is nothing but is going to be the mesentery is arising from the Miso Appendix, so which is arising from the lower surface of the mesentery of the terminal ileums. So these are the terminal ileums, so which is also is the lower part of the small intestine. So this mesentery is originating from this terminal ileum. So it's going to attach to the appendix. So and also, so these are going to attach to the iliac appendicular artery. So it's a branch of lower division of ileocolic artery. So it lies in the pre-border of the Miso Appendix. So it's going to the pre-border to the Miso Appendix. So if anything damage, or if anything damage to this artery, is especially is the appendicular artery. So if any thrombus formations, so if any occlusion of these blood vessels, so it may use the decreasing the blood supply to this appendix, so may chance to get the gangrenous and also appendicitis. So it's because of the thrombosis formations, any blockage of these blood vessels, any occlusion of these blood vessels, so it may use the decreased blood circulation to the appendix. So because of the decreased blood circulations, so it will give the necrosis and also gangrene. So it leads to the gangrenous appendicitis. So if anybody gangrenous appendicitis, so he's going to get that. So he's going to get the gangrene appearance will be in the appendicitis. So these are going to give the severe complications if they burst, or because of the fecal material may chance to get dislodged inside the appendix. So if it's broken or the burst inside the in the abdomen, so it may going to give the severe complications and also sepsis.